5. And the CDC says it may be time to wear masks again. Joining us, Dr. Bill Hartman, principal investigator for the UW Health Pediatric Moderna vaccine trial. Doctor, great to see you. Let's start with this latest surge in cases. Do you think we've peaked yet? I mean, for the first time in weeks, the 7-day average in cases and hospitalizations, they actually dropped slightly after we saw that steady climb. Deaths actually down to an average of 1 per day statewide. Where are we right now in this latest surge?
Well, I do think that we've probably hit the peak, or at least very close to the peak, especially with these variants of Omicron that have come out. They are highly contagious. They've infected many, many people. But in what I'm seeing and how I feel about things, I really think that the vaccines are doing what they were intended to do, and that's to keep people out of the hospital and keep people from dying from COVID-19. And that's exactly what's happening. Even though more people are getting infected, we're not seeing the number of people swarming the hospitals, definitely not seeing the number of deaths, which are all very positive metrics going in the right direction.
Yeah, that is good news. We do have a lot of people, though, who do have COVID, as you mentioned. We now have 2 counties in our area that climb back into the high category for community transmission, Racine and Kenosha counties. And the CDC says masking again should at least be considered for high counties like that. Do you agree?
Well, I think that layers of protection are always going to be the new normal, especially as cases rise in different places. So calculate the risk for you and your family in the area that you're at. If you're already vaccinated, that's one layer of protection. But then if you're going to be inside, if there's going to be many people around that you're not used to being around with, consider wearing a mask as another layer of protection. And then remember things like social distancing, washing hands, doing all those things that really can help keep you safe and COVID-free.
Just know in places like Racine and Kenosha County, the risk is higher. Hey, I want to ask you about this. Big news, the FDA approves booster shots for kids 5 to 11 years old. So who needs them, where can you get them, and when should you get them?
Well, and perhaps as a little bit of breaking news, too, now that the CDC a half hour ago voted 11-1 to affirm the FDA's action to approve booster shots in the 5 to 11-year-olds. So now it just comes down to Dr. Walensky signing off on that. And the boosters should be readily available to anybody who wants them or anyone who's completed the primary series. The important thing here is the language used is that children should get a booster. It came down to may versus should, and the CDC voted that the language should be should. And so it really helps think of this as a 3-shot vaccine, two in the initial series and 1 5 months later. And that's really what it will take to be fully vaccinated at this point.
Before you get boosted, you got to get vaccinated. Just 27% in that age group have gotten any shot so far. Dr. Bill Hartman, breaking news for us on Fox 6 News at 4. We appreciate your time.
Thank you.